know, right? Uh,
They need to turn it on in the back, so we'll
All
just
right.
need to cue them that we're ready.
okay, thank you. Ready? Good morning, everyone. As soon as everyone sits down, we'll start. Good morning. All right, it looks like we're almost ready. A few more people are going to have a seat. Well, my name's Lori Kaplan, and I'm the president and CEO of the Latin American Youth Center. And I am so proud, honestly, and happy to welcome all of you here this morning. This is really a big day for the Youth Center, and for many of you in this room, quite honestly, because this was a collective process, I will say. And so we're very, very happy to welcome you all. We're also really happy to welcome those of you around the country who are watching this live stream. We have quite a few people who wanted to be here, couldn't, or didn't live here, so we're streaming this as well. So I'm just going to take a couple of minutes. Many of you know about the Youth Center, but we are approaching 50 years old. We're what's known in the literature today as multi-service, place-based, regional. There's lots of definitions of who we are. Basically, we're an organization that loves to help young people. And we do that, we've been doing that for many, many years. Our mission is to empower a diverse population of youth to achieve a successful transition to adulthood through multicultural, comprehensive, and innovative programs that address youth social, academic, and career needs. What many of you have heard me say, we've never been about sort of opening and closing a case. We're really about wrapping our hands around young people for many, many years so that when they leave the youth center, they're on a successful pathway to a career and education. Our commitment to innovation that benefits our youth I think, speaks for itself, given that we're, 50 years later, we're still around and we're still innovating and we're still doing many, many things. But I just want to tell you a little quick story about the Promotor Pathway. I think it was about 8 to 10 years ago, we were engaged in a strategic planning process. And we were very proud of the many programs that we had, and we felt that we were getting good outcomes, although this was sort of on the front end of our capacity to actually have a whole learning and evaluation unit embedded inside the youth center, which we have today. But at that time, we knew we were helping a lot of young people. A lot of our outcomes were sort of specific to any one program. But we also realized that there was a community of young people that were always at the youth center and were growing up at the youth center, and they needed more. They needed more than just a very specific program intervention that might be somewhat short-term, because what we started to see is they'd be in one program, then they'd look for another. They just didn't, they wanted to be at the youth center. And we also noticed through a lot of, I would say, qualitative analysis in those days, the kids we knew them and would talk to them, that there was someone inside the youth center that they were just attached to like glue. That it didn't matter whether it was the IT person or, there was a lot of, but they would just sit at their desk and they would be there with them. Anyway, to make a very long story short, a large group of staff came together and said, what can we do for the young people at the youth center who need more? who need a deeper dive, who need a long-term commitment. And they were talking specifically about the kids that the literature, in those days, no one was talking about disconnected or opportunity youth. It was just young people who we knew had a variety of issues going on in their lives that were really, really tough. Any one of those issues could have been a challenge, but when you have 5 or 6, mental health, homelessness, perhaps young parenting, when you couple all that together, you had a lot of challenges in front of you. So I'm not going to steal the show, but I'm going to say it was out of that conversation and a strategic planning process that the Promotor Pathway was born. The last thing I want to say, the next thing I'm going to say is that we are a sub-recipient of the Social Innovation Fund program through Youth Connect, an initiative of venture philanthropy partners. So that's the current framing of how we got here today. And what I do want to say is that in hindsight, and this is about 8 years worth of hindsight, the stars really aligned for us to be here today. And many of you in this room are part of that star alignment. And I'm not going to call each one of you, but there were funders who stepped in at the very beginning, researchers who helped us figure that out, and our board members who are researchers. The stars just aligned because this was a long-term, complex effort that we undertook from a very community-based, place-based ideology. So I want to say from the bottom of my heart to the team that designed this, thank you, and to all of the stars in here, all the rock stars in here that aligned around us to make this possible, from the evaluation to the social, it's so many. Thank you, and that is why we're here today. So this investment has allowed us to expand and evaluate this, what you're going to hear about today, the Promotor Pathway. So I'd like to introduce as we start, because there's so many great people here today that you're going to hear from, but we're going to start with Damian Thorman, who's the director of the Social Innovation Fund, the Corporation for National and Community Service. And I'm going to read his bio, which is extraordinary, but I'm also going to say I remember when we started hearing about SIF. And it was like, what is this? How do we kind of get into it? And what can we do to be a part of this? And how does it work? And there was lots and lots of meetings, and it was, front and center in President Obama's imagination and dreams, and he made it happen. And we figured it out, thanks to a lot of you in this room. So Damian is a recognized leader in the world of innovation, philanthropy, and public-private partnerships. He most recently served as the founder and CEO of True North Philanthropic Advisors, previously as the program director of the John S. and James L. Knight Foundation. He developed a $40 million Tech for Engagement initiative that united technologists with social entrepreneurs and civic leaders. At the Knight Foundation, Damian was also the chair of the National Fund for Workforce Solutions, a SIF grantee. Under his leadership, that fund grew from $100 million to $200 million, provided career development services to nearly 55,000 people, and served nearly 4,700 employers. These numbers are so big, sort of hard to wrap your hands around, but an extraordinary accomplishment. He was highlighted in the Grant Makers for Effective Organization Stories of Impact to promote grant-making strategies and practices that contribute to SIF grantee success. Before joining the Knight Foundation, Damian led efforts to transform the Ewing Marion Kauffman Foundation from charitable to outcome-based grant-making. Previously, Damian was an attorney for the Jackson County, Missouri Prosecutor's Office and served on the staff of the U.S. House Education and Labor Committees. We're so honored, Damian, that you're here today, and we'd like to welcome you. Thank you.
Thank you, Lori, for that very kind introduction, and I'm really excited to be here. Excited to be here, Carol, and I won't say very long-standing friend. For many years, we've been through many different careers together and worked very closely. So I'm excited to be here and again working with you. I do want to also recognize Melissa Bradley, who is one of my predecessors at the SIF as a former director. I'm so excited to be here to learn more about what you all have been up to. SIF is now going to hit $1 billion this year, so that's pretty exciting for us. We're really looking and learning, and we continue to learn many lessons from the work of you all. The work gets done. We're very fortunate to be funders, and those of you in the funding position, you know that the real work happens here on the ground by you all. The Social Innovation Fund, Venture Philanthropies, Partners, and Latin American Youth Centers have a great deal of synergy in this work, and that synergy is what brings me here today. Your work in designing and implementing the Promoter Pathway model underscores SIF's early belief that what we've been creating and testing is an excellent example of finding what works and making it work for more people. That's what SIF is really all about. The Urban Institute's expertise in conducting external evaluation has provided additional findings that give the project the credibility that we can continue to bank on for the future. It's this evaluation, as many of you know, is central to SIF and to the work you're doing. These reports represent a strong and unambiguous statement about the determination of SIF's program participants, including grantees, nonprofits, contractors, that they understand that they hold themselves accountable to accomplish what they intend to do based on hard data. Second, and possibly most important, these reports contain unique, rich treasure trove about the practices and approaches relating to an array of processes that are critical to the success of any nonprofit organization. These methods include cost and of rigorous evaluations, lessons of conducting open and competitive selection processes for grantees, approaches to building key operating capacities, and organizational scale. Last but not least, these reports contain data-driven observations and conclusions about the extent to which SIF actually works, something we're a little interested in, as well as substantive recommendations on how we can improve going forward. Bottom line, the report shows that the findings are clear, well substantiated, and by and large, very positive. Now, last but not least, the SIF National Assessment, an independent and rigorous study commissioned by SIF last year, confirmed that the SIF has made a difference for both intermediaries and grantees around building capacity and around evaluation. The SIF National Assessment found that compared to a national sample of grant-making nonprofits, SIF grantees reported more growth in 3 key areas, including, first, conducting rigorous evaluations of their programs. Second, using evaluation findings to improve those programs. Third, using evaluation findings to demonstrate and communicate effectiveness of programs funded by the organization. Now, LAYC's rigorous 5-year evaluation of the Promoter Pathway model used a randomized controlled trial study design. Now, VPP and the CNCS support for this work is a great example of the kind of commitment that we bring to the program based on evidence building and evaluation to test and assess the programs funded through SIF. I'm very excited, as I said, to be here. I'm going to be listening and learning a great deal. I thank you again, and thank you so much, most importantly, for the very extraordinary work that you're doing in the field every day. Thank you.
Thank you so much. So the way that SIF works, and I think most of you know this, but you have to have in your community or nationally a local intermediary, someone who will step up and vouch for the work being done in the region, in the community. And we were very, very fortunate. And I think I must have knocked on Carol's door maybe about 50 times. And those of you that know me know I can be somewhat relentless in my desire to make things happen. So when SIF, it's true. So when we first started hearing about SIF, we said, you know, who can make this happen for us in our city? And we knew that it was Venture Philanthropy Partners. So we went to VPP and said, I hope you're going after this. So I am really honored to tell you something about the president and CEO of Venture Philanthropy Partners, who's with us here today. Carol is president and CEO of Venture Philanthropy Partners, a philanthropic investment organization that helps great leaders build strong, high-performing nonprofit institutions. Carol brings to VPP over 30 years of management experience in the public and private sectors, as well as a strong history of leadership in the National Capital Region, nonprofit community, and local government. She served as a special advisor to President Clinton on the District of Columbia and executive director of the DC Interagency Task Force. Prior to serving in the Clinton administration, Carol was the vice president for government and environmental affairs at RJR Nabisco, where she developed a corporate-wide environmental program and functioned as a Washington representative monitoring public policy issues. Carol spent 12 years in the government of the District of Columbia. This is when we met, holding major management and staff positions, most notably as the first woman, and at that time the youngest person, to be appointed city administrator. She is a member of many boards and has been recognized for her outstanding leadership and dedication to the regional nonprofit community. I am really honored to be able to say thank you publicly, Carol, to you, because without VPPs stepping up and applying for and winning a SIF application, we would not be here today. So thank you very much. Carol Thompson-Cole.
Thank you very much, Lori, for having VPP be here today, and good morning to all of you. As Lori said, VPP concentrates growth capital, expertise, and now multi-sector collaboration to develop transformative solutions to our region's most challenging problems. And so we're very excited that VPP from the beginning was focused on outcomes and driving impact for children and youth in the region. We are known for being one of the first philanthropic organizations in the region, actually in the country, to invest in performance management and evaluation as a critical component of a nonprofit's organizations. So we did lead the effort to win the Social Innovation Fund grant. That's created Youth Connect, and we included the Promotor Pathway. And so in partnership with the SIF, VPP has invested in 6 nonprofit innovations. While each approach or innovation is different, every organization is focused on helping vulnerable youth successfully transition to adulthood. Along with Latin American Youth Center, the network partners are College Summit National Capital Region, KIP DC, Metro Teen AIDS, which is now part of Whitman Walker Health, Urban Alliance, and Year Up National Capital Region. So in 5 years, we've catalyzed a network of high-performing nonprofits in the National Capital Region that are improving education, employment, and healthy behaviors of more than 21,000 youth ages 14 to 24 across this region. And we are so excited to be able to say that we've accomplished this in 5 years. During this process, we've helped our 6 partners knit together the social safety net, influencing the way nonprofits informally and formally, work together to improve outcomes for youth. So, as you heard, VPP is an intermediary. We played the backbone role in this effort, and we've worn many hats in doing it. We guided Youth Connect's strategic agenda. We've worked with Child Trends to lead the development of the Shared Outcomes Framework, which helped our network partners serve youth together through collective effort and not just through individual efforts. We supported data collection and assessment of each program's performance, and we focused the group on getting to consensus and to collective action. So VPP is proud that we've been in partnership with the Latin American Youth Center since a planning process in 2004, which led to a multi-year investment of capital and strategic support. Now, we recognized early what everyone in this room knows, that LAYC is very special. To have a strong leader like Lori Kaplan, to plan for a long time to expand programs and services beyond the District of Columbia and into Montgomery and Prince George's County in Maryland. They're one of the few youth organizations, particularly years ago, that decided that they wanted to have an outcomes-oriented culture throughout their organization, and that they had a senior level position dedicated to outcomes measurement. So from the beginning of our thoughts about Youth Connect, we knew that Latin American Youth Center had to be a partner. So LAYC has lived up to the promise of the Social Innovation Fund, taking a tested innovation and scaling and adapting it to what works. So the Promotor Pathway has been expanded into Suitland High School as a part of Youth Connect's recent integration into Prince George's County, Maryland. And our funding is also helping to support the Promotor Pathway's national expansion to Oregon and California. Today, I'm excited, BPP is excited to be a small part of this, so we applaud LAYC as a partner, and we look forward to continuing to work with you as we continue to work on behalf of vulnerable youth in our community. Thank you.
So now, as we get to what we all want to learn more about is the Promotor Pathway. I am really honored to introduce Susana Martinez. And as she comes up, I want to say a couple of things. You know, it's one thing to have a good idea. It's another thing to, make it happen. And I often have lots and lots of good ideas. Some of which happen, some of which don't. But what made this happen was Susana's leadership. I'm going to tell you about Susana's in a minute. But also a whole lot of Latin American Youth Center staff. And many of the promoters are here, and the young people, you'll get to meet them today. But I just want to say, you know, nowadays you go places and everyone's talking about investing in talent. Well, there is so much talent to invest in at the Youth Center, and it's kind of like, well, of course that's what you do. And Susana is the shining example of when you say to someone, now here's this idea in a strategic plan, that she was a part of developing, let's bring it to life. And boy, did she bring it to life. So I want to just say thank you, Susana, and to your team, and actually Tony, Isaac, a lot of our team is here who you'll get to meet. But let me give you the formal introduction. But I just wanted to say she's an extraordinary leader and promises to take this model to new heights. Susana is responsible for the national expansion of the Latin American Youth Center's Promotor Pathway, an intensive case management model for disconnected and disengaged youth. You're going to learn a lot more about it. She was a key member of the team that first developed the Promotor Pathway and served as director during the external evaluation of the pathway as part of the SIF investment. She's a licensed independent clinical social worker who worked with Latino communities and youth of color in Texas and the Washington, D.C. region. She has for over 15 years of youth development experience and has expertise in providing clinical and case management services to immigrant families, victims of domestic violence, and youth and families within the child abuse and neglect system. In addition, Susanna has trained staff in areas of crisis management, positive youth development, and motivational interviewing. Prior to her current position at the Youth Center, she served as administrator of the center's residential foster care programs, where she ran 2 group homes for foster care youth. She has presented at various conferences, sharing best practices in serving disconnected youth and the importance of measuring outcomes. Please welcome Susanna. As she kicks off our program, I do want to note, because I will probably not be back up here, I want to thank our board of directors, many of whom are here today, because this was a long-term effort, and we invested in it, and it was the board's leadership who really worked with us to make that happen. So thank you to all the board members. Susanna Martinez.
Thank you, Lori. Thank you, everyone. Welcome here this morning. Welcome to those that are viewing online. Before anything else, we do want to encourage you all to tweet about this event. We would love for more people to learn about the work that we have been doing with the Promotor Pathway. So if you can please use the hashtag LAYC Solutions for Youth so that we can keep this conversation going beyond today's event. As Lori mentioned, this model was born out of the need that we saw in the community. In August 2008, the Promotor Pathway was created as a long-term client management intervention model for disconnected and disengaged youth, whose obstacles such as lack of education, homelessness, trauma, substance abuse, and court involvement prevent them from accessing the resources and achieving educational, employment, and healthy living goals. Our name, promotor, or promotor, is a Spanish word that refers to the community health worker who provides health education and guidance in accessing resources to their fellow community members. LAYC's promotores work on a one-on-one basis with each youth to remove barriers, proactively encourage participation in services, and connect them to other needed resources within the community so they may make a successful transition to adulthood. The Promotor Pathway model focuses on cultivating and maintaining a lasting and trusting relationship with youth. Promotores support youth through small wins, provide 24/7 crisis intervention in order to remove obstacles, and reconnect youth to their communities and support systems. Disconnected youth often have a variety of risk factors that cannot be quickly addressed, and the long-term relationship of 4 to 6 years on average enables promotores to create lasting change. These promotores act as mentors, case managers, community health workers, and advocates for very high-risk youth. These highly trained and experienced staff work intentionally and deliberately to build relationships designed to transform a young person's life, working across programs to address all the youth's needs. As Lori also mentioned, and Carol and Damien before, LAYC is committed to developing an effective model for youth. Measuring that effectiveness requires an internal evaluation, and Urban Institute has been our partner in that effort. I would now like to introduce Brett Theodos, who is a senior research associate with the Metropolitan Housing and Communities Policy Center at the Urban Institute. His expertise is in program evaluation and performance measurement of interventions to support vulnerable families and communities, including financial capability, asset building, employment, and support programs, and affordable housing. Examples of recent and current projects he has led include a random controlled trial impact and implementation evaluation of 2 financial coaching programs for the Consumer Financial Protection Bureau and Annie Casey Foundation, an impact and evaluation of Urban Alliance, along with the impact evaluation of the Promotor Pathway. Beyond these efforts, Mr. Theodos has conducted several studies on affordable housing and place-based interventions to upgrade distressed communities. Mr. Theodos directs Measure for Change, a partnership with the World Bank Group, which hosts a community of practice and provides technical assistance for local nonprofits to grow these groups' capacities in performance measurement and evaluation. We now welcome Brett Theodos, who will tell you more about our research.
How's everybody doing this morning? Good. Good to have you here. I want to take the chance to welcome you here to the Urban Institute. If you haven't been with us before, we're excited to have you this morning. Before I jump in, I also need to do a few thank yous. The first goes to Susanna and to Tony, who have been terrific partners along the way with this study. I've had the opportunity to evaluate a lot of programs, and few organizations have staff of that caliber that have made our lives that easy over the years. So a tremendous thanks to you both. I also wanted to extend a thanks to SIF in particular. I say that not just because I'm getting paid to do 3 SIF studies and it's in my self-interest, but because I really do appreciate the investment that SIF is making, not just in growing program models, but building our evidence base. Because as much as it might feel like we have a lot of evidence about what works, we actually don't, and it starts to get really thin when we look at individual programs for specific types of interventions for specific types of populations. So we're excited in a small way to help grow that evidence base today. And also a thanks to VPP. It's hard often, I think, in philanthropy to make bigger investments that are really catalytic, and I think that's an important model for the philanthropic sector. So thanks to you as well. Okay, on to the meat where we can geek out a bit on what the data are saying. So to orient you today, I'm going to give you just a brief overview of the program and the study. Susanna gave you some of that. I'm going to talk about the baseline characteristics of youth, what they looked like when they walked in the door. I'm going to talk about how many and what type of services they actually got while they were in this Promotor program, and then I'll zero in on what people really came to hear about today, which is what were the impacts that were achieved by the program. Okay, so study design. The Promotor provides mentoring, advocacy, coaching, case management services. It really is meant to be a holistic kind of wraparound relationship-based engagement program. It is a long-term relationship with a caring adult. And this individual, of course, provides services his or herself, but also refers out to services in the broader LAYC suite, and then beyond LAYC as well. So youth are intended to meet with their promotor 1 to 3 times a month, communicate, phone, email, text, all available options. And the caseload is targeted at 1 to 15. The enrollment for this study, since expanded, but came through the Washington, D.C. flagship headquarters, as well as in Silver Spring and in Langley Park. So how did these youth get slotted in to this type of program or this type of help? The first key thing to understand is that when youth came into LAYC, they were given a screening assessment. And at that intake, they were ranked on several factors related to housing insecurity, school non-completion, lack of employment, substance use, mental health. And those youth who were deemed high risk or very high risk for on this screening metric were invited to participate in the Promotor Pathway program. They could say no, of course, and certainly some did, but many didn't. And what did this pathway intend to achieve with these youth? The answer was a lot of different things. And that includes things in the academic realm, depending where they started. So that could be a GED or a high school diploma. It could be college attendance. In the employment realm, it could be job readiness or job placement or certifications. Could be things related to housing security, homelessness, doubling up or moving a lot. Healthy behaviors, things related to delinquency prevention and reducing early parenting and substance use and sexual health. Things related to self-efficacy, like having an enhanced ability to navigate systems and secure resources. So you can see there's a lot of things that the program is trying to achieve, and different youth need different things at different sequences in their life. And that really is the job of the promotor, to figure out what they need and help them work their way there. So how did the study get designed? The first thing is it's a random controlled trial study. So what that means is you proverbially flip a coin, and some people get a chance to get access to this promotor, and some people don't. And the reason that not everyone gets an access to the Promotor is not because we're mean researchers and we want to deny people access to a service so that we can have a good comparison or control group. It's because the Promotor program itself only had the capacity to serve so many people. And there is more demand. There's more need out there than the program itself was able to achieve. And so what happened is 476 applicants enrolled in the study between April 2010 and February 2013. And again, they were recruited from this pool of LAYC clients, the high-risk individuals. And so a third of those people received a Promotor. That's how many the program was capable of serving. And then the remainder was sent into this group we call the control group. So most of the results I'll be talking about today are comparing those people who were given a Promotor with those people who weren't. And so one good question is, well, what did the people who didn't get a Promotor get? And in this case, it's not this way for every random controlled trial study, but in this case, clients assigned to the control group were still eligible for all other LAYC services, which, as you've heard, they have a full suite of services. So you can think of this as, in some ways, a top-up study. This is a study that's just testing the increment of the Promotor on top of all the existing LAYC services. So I want to emphasize that, and I want you to keep that in mind when we're thinking about all of the results that are coming. We're not comparing the Promotor to what would have happened if youth hadn't shown up and hadn't engaged in LAYC at all. Very likely those effects would be bigger in multiple directions and stronger. What we're testing is only this increment of the Promotor versus everything else you can already get at LAYC. So it's the addition of this increment on top of that base. So keep that in mind as we're going through the results. So there were baseline surveys at 6, 12, and 18 months at follow-up with a 76% response rate. And the data really derive the outcome data largely derive from those surveys. Okay, so who are the applicants? Who are the youth that were coming in the door? Just a few demographic characteristics to start. They were pretty balanced in terms of males and females. And I should say this is for both the treatment group and the control group combined. I've done that because there weren't systematic differences between the treatment group and the control group, which is what we want. When we pick people at random, we have reason to believe that they should be really comparable. And they were, thankfully. So this is both groups combined. In terms of race, ethnicity, over half were Latino, but a sizable share were non-Latino Black. Near half spoke Spanish at home. There was a mix of ages, so the program targeted youth age 16 to 24, but it was somewhat segmented in that group, so there was about a quarter that were under 18, over half in that 18 to 21 range, and then another fifth were 22 or older. And again, this is at the point where they started engaging in this program or in the control. Parenting was high among youth in this study. So for men, 1 in 5 were already parents by the time they had begun the study. And for females, 2 in 5 were already parents. In terms of education, 47% were enrolled in some form of school, another 37% in a GED class. The highest grade they had completed ranged 9th, 10th, 11th. 25% had a high school diploma. Only 2% were engaged in a two-year college or degree or some sort of certification program at baseline, and 22% were employed. Looking at some risk factors and behaviors, as we've termed it, so 40% at the point of baseline received SNAP benefits, food stamps. 14% had at some point in the last 6 months slept in a shelter. Oops. I'll let that get fixed. 14% have been in the foster care system before. 24% have a learning disability of some point, and 14% carried a weapon, had reported that they'd carried a weapon in the past 4 weeks. 16% reported that they were injured while fighting at some point in the last year. 23% reported that they'd been arrested. Another quarter had reported that they had engaged recently in binge drinking, and another quarter in had used marijuana. So you're getting a picture of youth that are indeed high risk, as we expected, because they're screened to that effect. But that shows some of the opportunities as well as challenges that the promotors are engaging with. Next, we're going to look at service take-up. This is the proportion of youth that are actually receiving services, because this is an optional service for people who are young and who are somewhat transient and who have a lot of other things they could be doing with their time. So we found that engagement with promotors was remarkably high, especially considering that this is an optional service for high needs population. So fully 94% of youth had at least one contact with their promotor. So this is the treatment group. This is of those who were offered the promotor, 94% at least had one engagement. And we tried to predict how much engagement there was, and you can see it ranges to be quite a bit. And we tried to predict what baseline factors might lead somebody to be more or less engaged. And we actually didn't see that the baseline factors were that predictive in allowing us to understand what about the youth determined their engagement with the promotor. So the types of contact with the promotor could vary. As I mentioned at the beginning, it's things like in-person meetings, phone, text, and so on. So these contacts are a range of different modes that people are engaging in. We didn't get to do a process study of this program, so we'll need Susanna to come up and tell us the secret sauce about how she got take up to this high in this program, but it's a challenge. Let me see. There we go. Okay, so what we do see is that youth initiated more contacts when the overall number of contacts went up. So for youth who didn't have a lot of the contacts, what you get the picture of is that the promotor is carrying a lot of the water, is doing a lot of the initiating. But by the time that you get to having a lot of contacts, then it's the youth that's actually initiating those types of contacts specifically. And this makes sense. You want the promotor to provide a base level and then also to be there as a resource when the youths want more. We looked at the number of contacts per month, because remember, the intervention could go on for many months. And you can see there's a range, but often it's falling somewhere in this 1 to 5 area. We look at how long youth stayed engaged with their promotor, and you can see that a vast majority of them are staying engaged for the full 18 months. And remember now, we're cutting off our assessment at 18 months. So those that engaged for this last bar, that could in fact be longer. But as of the 18-month period, this is how long they had engaged by. So back to my comment about youth being able to receive other services. When we look at baseline, we can get the picture that these youth were engaged in LAYC. These were the youth, that's how the Promotor program found which youth to be involved with. And so you can see, looking at the treatment group and the control group, a lot of consistency, which we like, because at baseline we shouldn't see differences, that there is a high level of involvement in a number of activities related to education, some case management, healthy behaviors, and workforce. And the vast majority of youth were engaged in at least one LAYC program by the point of baseline. Okay, so here's the first kind of output take-up finding, if you will, is to what extent did the Promotor program actually increase the number of services that youth received? Because again, they're eligible to receive all of the existing baseline LAYC services, and to the extent that we want to see outcomes, we very likely will need to see increased service use. And indeed, we do in the range of several services. And so these data come both from administrative sources that the LAYC keeps, but also from survey data that youth reported. And so we see that the treatment group youth were variously between 8 and 29 percentage points more likely to receive services if they said they needed them in the areas of mental health counseling, substance abuse, obtaining public assistance, finding housing, and legal problems. Also that they were more likely to participate in a program potentially outside of LAYC in the areas of healthy behavior, education, workforce, or any of the above. So what you see is a pretty sizable increase in service receipt for treatment group youth. And again, that speaks in part to the services the Promotor is providing, but also largely to the services that the Promotor is referring the youth out for and trying to make sure that they actually follow through on that referral. Okay, so now the part that you're really here to hear about, which is the impacts. So I promise not to give you too much methodology early in the morning, but just very briefly, what we've done is something called an intent to treat analysis, where we study outcomes at the point of an initial treatment assignment and then at the point of follow-up. And so what we're going to do largely is check how this treatment group is faring against this control group. And we're going to check everyone in the treatment group, not just those who got the service, because that allows us to say it wasn't just self-selection that was driving the results. It just wasn't the most motivated people that showed up. And if we just look at those who showed up, then some people start getting skeptical that it really was the youth's own motivation and not the program itself. So we take a lens through this whole group, this treatment group, whether you showed up or not, and compare them to the whole control group, because we think at baseline those groups were similar. And the only thing that differs now is whether they got access to this program or not. There are some other ways to look at program results, and we have those in the report. I'm not going to go into them here, but it's something called treatment on the treated, where you can just look at those who actually showed up for the service or showed up for a certain amount of the service. And so those results are in there. For this particular program, this is less of an issue because such a high share of the treatment group actually showed up for treatment. So if I've lost you on the methods, don't worry about it, but just know we're going to be basically checking how the treatment group did versus how the control group did. And we'll do that by looking at a few means, but we'll also do some regression adjustments just to make sure that we're getting the most accurate picture that we can. And for the most part, we'll be talking about differences as of that 18-month follow-up, but we show more results in the paper. Okay, so starting with education. We see that the treatment group was more likely to be in school at 18 months, 52% for the treatment group versus 39% for the control group. And this will be woven throughout the findings, but there's some really interesting differences with respect to what we call subgroups of the treatment group. So we looked at a number of subgroups, including those by gender, those by race, ethnicity, those by number of contacts, age, etc. And we see some pretty consistent differences for men than for women, for Latinos than for non-Latinos. And so I'll highlight some of those differences along the way. So again, we have this overall result that we see that the treatment group is more likely to be in school. But what's interesting is we see that result for men. We don't see that for women. We see that result for Latinos. We don't for non-Latinos. And it's not true that all of the men are Latinos. So it really is those two separate groups. Obviously, there's some overlap. And so it's interesting that those groups in particular appear to be benefiting on this measure from the program. We don't see an impact on attainment of GED by the 18-month window, or on high school diploma, or on college attendance. But we do see that males were more likely to attend college, though there was actually a negative, but it wasn't significant impact for females. Now, turning to employment. As of the 18-month period, we don't see employment impacts in terms of hours worked per week or weekly wages. We do see that males were actually less likely to have worked recently, with fewer hours worked per week, not an effect for females. And that's actually not a surprise, and in some ways it is a positive finding. And what it's showing is there is a real trade-off between work and school at young ages. So as we see more males in school, we see fewer of them working, and so that's not a surprise. Okay, in terms of births, the treatment group youth was fully a third less likely to have a child in the last year of the study period. And so that's 14% versus 21% for the controls. This is a pretty big difference and a pretty meaningful difference in delaying early parenting or just limiting the number of kids in a household. What was interesting as well for this is that we saw this impact for males, but not for females. And we again saw it for Latinos in particular. Looking at housing stability, the treatment group youth were less likely to have reported that they slept in a shelter in the last 6 months of the study period. 4% of them did versus 10% of the control group. And here we actually have the situation where it looks like that impact was driven by females, not males, and by African Americans, not Latinos. And there certainly are some differences in shelter use for those populations. Turning to substance use, delinquency, and violence, we did not see an impact on the use of marijuana or other drugs. And this is interesting. The treatment group were actually more likely to report binge drinking than the control group was. In terms of delinquency and violence, the treatment group were actually more likely to have reported that they got in a fight that required them to seek medical attention, and were more likely to have reported that they sold marijuana or sold hard drugs. So do we think that the program actually induced people to these behaviors? Not necessarily. There's a couple of theories about why this appears. One is perhaps they're being more honest in their reporting. If their promotor knows that they're doing these things, they might be more ready to admit them on a survey than the control group could. But there's other theories as well, and we actually know from some other evidence that in some ways, youth who don't have kids actually do engage in more substance use and drinking. And so maybe there may be more going on here than we actually understand. In terms of relationships and self-efficacy, we see that the treatment group youth were more likely to report that they had a special adult in their life, 88% versus 80%. And here we see the impact for females, not for males. We don't see an impact on what we call the positive peers, a scale, a set of measures that look at positive peers or at negative peers, or on some concept we call mastery. So, those are the set of findings, and I realize it's a lot of different types of indicators. And indeed, as we said from the very beginning, the program is trying to accomplish a lot of different things. So a few summary observations to wrap up. So first, we know that there is additional support being provided by the promotor beyond the direct LAYC services. We've demonstrated that, and that appears to benefit youth in a few key areas, including things like early parenting, being in school, avoiding sleeping in a shelter, and having a special adult in their lives. But we also see that some of these results are driven by one subgroup or another, which is really intriguing and calls out for more investigation. And understanding more about the promotor relationship with the youth will help to understand and explain some of the reasons why some of these groups are advantaging more than others. But next I wanted to add that it may well be that 18 months isn't long enough to observe some of the impacts of interest, and we recognize that, and LAYC can talk a little bit later about the work that they're considering entering into to do longer term tracking. But things like college entry and degree attainment just may not be able to be evidenced within the 18-month time period. A few final observations in terms of the evaluation. There is, we acknowledge, some difficulty, some ambiguity in defining treatment. So is having one text message or one voicemail from your promotor really getting treated? Well, most people would probably say no. But then where do we draw that line? It gets very difficult for us as researchers to say, so we've done our best look to try to understand it along the way. The next thing is that, not all contacts are equal. And so even if you could count contacts well, it's not necessarily the case that 10 is better than 5 without really understanding the nature of those. So that it makes it hard for an evaluation perspective to get under the black box of the program and really understand what it's doing for whom and when. It's difficult to detect from an empirical standpoint impacts given the large array of different services that are offered. So when the program is trying to do so many things, and certain youth are making gains in certain areas, but we need to measure every youth's gain in those areas, it just makes it harder from an evaluation standpoint to be able to detect those effects. In other words, if we're looking at GED attainment, but half of the group has already graduated high school, well, then those people are not going to get a GED. So it just poses challenges from an evaluation perspective, and it means in part to me that the fact that we're achieving, that the program is achieving the impacts that it is, are the more impressive given the variety of things that are being worked on. And next, the last point that I'll make is that it's very difficult for us to assess the replicability of the program in different contexts with different types of youth, especially given some of the differences in subgroups that we see. And it's difficult in part because we don't have a good insight into how the promotor is interacting with the other existing LAYC services. So if you think about extracting the promotor model without the existing LAYC service space, you might think in part the impacts would be stronger because it's that versus nothing. But you might think in some way that the promotor benefits relies on having the strength of the existing LAYC services to refer to. So as every good researcher says, more research needed. Thank you.
So I actually will invite Brett to come back up if there are any questions from anyone in the audience regarding the findings that have just been presented. Please raise your hand, and we have microphones that you can use if you would like to make any questions. There's one over here. Great.
Thank you. Fascinating. I just have a very quick...
If you don't mind saying your name and where you're from, that'd be
yes,
great.
yes, I'm sorry. I'm Betsy Griffith, and I'm with VPP. Just a quick question about significant adults in their lives. Might that include the promotore?
Yes, it might. Yep, absolutely.
Andrea came from the National Campaign to Prevent Teen and Unplanned Pregnancy. First of all, congratulations. These are really exciting results, and seeing the needle move that much on early parenting is a big deal. Obviously, I have lots of questions given some of the subgroup impacts. I'm just kind of curious if people have any sense of, why males and not females, what kind of referrals for services outside or services inside LAYC might have contributed to the drop in early parenting. Just anything more you can share, I think, would be of great interest.
Yeah, I'm going to let Susanna take the hard part of that question, but I'll take the easy part, which is it is a really big deal. And there's a lot of programs out there to try to reduce early parenting, and the evidence base is really thin about what is successful. And so it is a meaningful finding. Do you want to talk to men and women?
Sure. What we did find really interesting and was, I believe, also part of the findings was that access to sexual health services was not necessarily a notable factor in being able to measure that impact. So it allowed us to really analyze the relationship with the promotor. I don't know if there's necessarily any distinction between the way we serve our males and our females. I know that there is other research around pregnancy prevention that does talk about that relationship with a caring adult as being a very significant preventative factor. So we would definitely like to explore more as to why that's happened with males. I think males perhaps don't necessarily have those conversations as often as maybe females do. They tend to be targets of pregnancy prevention efforts more than males. So maybe just taking the time to engage with a youth about that issue might have led to that impact.
Other questions? Nick.
Nick Harrington from DC Promise Neighborhood.
Let me wait for the mic because the folks on the web can't hear you if we don't have it. Thanks.
So Nick Harrington from DC Promise Neighborhood Initiative. Curious to know if any consideration was given to using administrative data for any of the outcomes, such as like school attendance or justice involvement.
Yeah, certainly. It's hard, unlike some other programs, because, again, there's so many different types of outcomes that are being that are intended. And in terms of schools attended, there's so many different jurisdictions. So we just didn't really have the scope to compile all of those different sources. It's not like there's one go-to data source that we could use to get at a lot of these things. So the survey was especially important for this study. Thanks.
My name is Marcus Rosenbaum, and I was just wondering how many kids were there in the study, and were there enough to be able to break it down beyond the main numbers?
Yeah, so there are 476 that enrolled in the study at baseline. A third of those went to the treatment group and 2/3 to the control group. And then we had a 76% response rate by 18 months. So this sample starts to get a bit small by that point, especially when we start to look at some of the subgroups. But that said, given that we actually did detect differences for the subgroups, that's fairly meaningful. But what we couldn't do, for example, is look at the effect for Latino males. So we could say something about Latinos, we could say something about males. We couldn't look at Latino males because then our sample just got too thin.
Hello, my name is Ijama from DCP&I. I was wondering if you could just talk about any issues, I don't know who the best person would be to answer, but any issues with like data collection and data tracking for the two groups, especially since you had assessments and like all the case management data. I find that to be like one of the most, the hardest part of doing this type of study. So if you just talk about like what those issues were, any advice you might have for those doing this similar work.
Yeah, we've got a lot of thoughts. You want to take that?
Oh, yes. It truly was a commitment on behalf of the organization and the team to take the time to really focus on data collection. We had an incredible partner that was able to focus on the control group population in terms of outreach for follow-up surveys. Since they were not necessarily linked to a promotor, we realized that it would be very difficult to track them down at 6, 12, and 18-month intervals. So we were able to gather information such as social media, email addresses, anything that we could to be able to try and identify and find these youth further down the line so that we could gather their information. But it really was a lot of effort. This is a difficult population to track and a very transient population, especially when you add in risk factors such as homelessness and court involvement, that trying to find them even a year later can sometimes prove very difficult. But we were able to get a pretty significant response rate for both the control and treatment, and I believe it was above 75% response rate. So we were able to track them down, and a lot of that was just what we call relentless pursuit of these young people. And I believe we'll probably just take maybe one more question, and then we'll move on to the panel. So.
Good morning. I'm Ebony Rose Thompson, America's Promise Alliance. So I saw a lot of demographic info about the participants, but very little about the promoters. So I'm curious to know what their demographic makeup was, as well as if there were certain things you sought out or characteristics you sought out in recruiting those individuals.
Yeah, so we don't have a lot on that in the report. We do have a bit on their backgrounds, but maybe Susanna can just talk to it.
Sure, just briefly, the promoters themselves, we have a very diverse team. We have actually a pretty, I think, even split of male and female promoters. We also have, I think, a pretty even split of Spanish-speaking Latino versus non, and that diversity, we think, is what also allows us to create some very strong connections with our young people. We basically reflect the population that we're serving. And the other aspect that we're incredibly intentional about is that we seek promoters that have years of experience working with this population in the field, and many of which are former LAYC participants themselves, who have then gone on to work with the Latin American Youth Center and then became promoters. So all of that, we think, contributes to identifying a strong promoter. So thank you very much, and I want to thank Brett very much for sharing that information. And we will now be moving on to our panel discussion. I am very honored to introduce our panelists and our moderator, who will be taking the stage shortly. Come on in, folks. So before I hand it over to our moderator and the panel, I would just like to introduce Michael Smith, who will lead this conversation on innovation, evaluation, and replication. Michael is Special Assistant to the President of the United States and Senior Director of Cabinet Affairs for My Brother's Keeper at the White House. In this role, he manages the President's initiative to address persistent opportunity gaps faced by boys and young men of color and ensure that all young people can reach their full potential. Prior to joining the White House team, Michael served as director of the Social Innovation Fund, a key White House initiative and program of the Corporation for National and Community Service. Before joining the Obama administration, Michael served as a senior vice president of social innovation at the Case Foundation, where he oversaw the foundation's giving and program strategy and guided numerous sector building initiatives and public-private partnerships, such as the Startup America Partnership. Prior to the Case Foundation, Michael helped build national initiatives aimed at bridging the digital divide at the Beaumont Foundation of America and Power Up, served as senior program and communications staff member at the Family Center Boys and Girls Club in Springfield, Massachusetts, and was an aide to U.S. Congressman Richard E. Neal. We are incredibly excited to have Michael here, also just because of his commitment to this work and serving this population. So I will hand it over to you now.
Thank you. Good morning, everyone. It is an honor and a privilege to be here today. And it's so wonderful to see so many familiar faces that are like friends and family. What's up, Team SIF? Good to see you around the house. I miss you. I miss, you know, I say this, the transition from working for entrepreneurs to working in the federal government was not an easy one, and working at the Social Innovation Fund. The transition from going from the federal agency to the White House was even more of an interesting transition. And let me just say, I miss the SIF every single day. I miss the work that we were able to do together. I miss the extraordinary organizations that we got to work with, like Venture Philanthropy Partners and Latin American Youth Center. And I'm here because Lori asked me to be here. These are two of my favorite people that are sitting right here in the front. In a country and maybe a town that becomes even more narcissistic, I just admire and appreciate every day folks that could be going out making big names for themselves and making really big salaries for themselves, but have instead dedicated their lives, dedicated so much time, so much energy in service to others, working quietly, working with a results-oriented mindset, and really trying to make a difference for our kids and our families who are so often left marginalized and left out of the conversation. So Lori, Carol, anywhere you ask me to be, I will be there, and so grateful to have an opportunity to moderate this conversation today. And Damien, I got to say thank you for taking over the Social Innovation Fund and leading it in such a remarkable way. It's so wonderful to know that it's in good hands and to see the incredible work that continues to happen every day. So we're going to have a conversation here with this dynamic panel. We will do a couple moderated questions. You'll have an opportunity to hear a little bit from them, and then we'll go to your questions. I'll open up with just a little bit of a framing from the administration's perspective and why this is important. But before I do that, let me just go ahead and introduce our panelists. To my immediate left, we have Michael Pergament, who is a PhD and senior fellow in the Center for Labor, Human Services, and Population right here at the Urban Institute. He was the project director at ACF's multi-site evaluation for foster youth programs and has a remarkable career working in this space and an expert on all things RCT and evaluation. To his left, we've got my friend and colleague, Melissa Bradley, who when the White House said, will you come and take over My Brother's Keeper, I said, well, there's this SIF thing that is also a presidential priority. And Marissa's like, I got that. Melissa's like, I got that. And so Melissa was at the corporation at the time, serving as a presidential appointed head of strategy at the corporation, and she stepped in and served as the interim CEO of the Social Innovation Fund. Right now, she's director of the Entrepreneurship and Innovation Initiative and executive in residence at the Kogod School of Business at AU here in DC. And since 2012, she's been a professor of practice at the McDonough School of Business at Georgetown, and she's an expert on all things social finance and pay for success and social impact, and actually is a co-founder and managing director of a business that works on those issues with organizations such as Aspen and William Penn Foundation called Sidecar Social Finance. So Melissa, great to have you here. Next to Melissa, we have your friend, Jen Friend. Wouldn't that be a great campaign slogan? Jen Friend is your friend, a name you can trust.
Yes, I think so.
Jen is a successful attorney who, while she was serving in a successful practice, served as the president and secretary of the board of directors of Project Hope Alliance, really working and sharing her own story about financial struggles. And in 2013, she decided to leave her very successful law career to serve as the CEO of Project Hope. And under her leadership, Project Hope has grown from serving one school with less than 65 children to serving 300 plus homeless children, attending approximately 120 schools throughout Orange County. So we've got someone who knows a thing or two about scale and evidence. And next to Jen Friend, we have Lindsay Buss, who is the Senior Officer for Community Outreach at the World Bank Group right down the street, where he oversees philanthropic, volunteer, and a variety of other community activities, such as the high school internship program at the World Bank, and also works on the World Bank's newest funding initiative called Measure for Change. And before that, he served as 9 years as president and CEO of Martha's Table, the incredible DC nonprofit that's doing great work for our community. And then before that, he was a successful attorney as well. So I am well covered on my attorneys. I feel like I'm at the White House, so thank you for that. So we are going to have a great conversation with this. I'll provide just a little bit of a framing. This whole evidence agenda has been something that the president has been trying to push from the very beginning. The Social Innovation Fund was one of the first hallmarks of this, but this idea, that we don't have enough money to keep throwing away at organizations that are doing good, or are investing, or are telling us about anecdotes, or telling us about numbers served. But if we're going to make a real impact in communities, we have to invest where there's evidence of impact. And so the Social Innovation Fund was one of the great early programs that the president started that's working on that, has moved hundreds of $millions investing in evidence and scale. There are 5 other tiered evidence programs across the federal government. There's now an evidence working group across the federal government run by OMB and the Social Innovation Office. And we're really trying to push that agenda so that the government is really spending where there's evidence of impact and encouraging foundations and local governments to do the same. And from a My Brother's Keeper perspective, maybe because I'm running it, or Jim Shelton, who used to run the evidence program, I3 at Department of Education, was the first executive director. Maybe that's why evidence is baked in. But if you actually go back to the speech where the president started My Brother's Keeper, he talked a lot about cradle to college and career strategies. He talked a lot about how we need to make sure that young people know that they matter, that they have clear pathways to opportunity. He talked about the role of the private sector. He talked about the role of communities getting involved. But he also spent a very good chunk of time talking about the idea of evidence when we launched My Brother's Keeper. And I just want to read a quick quote from the president from that speech. He said, "We don't have enough money or time or resources to invest in things that don't work. So we've got to be pretty hard-headed about saying if something is not working, let's stop doing it. Let's do things that work, and we shouldn't care whether it was a Democratic program or a Republican program or a faith-based program, or if it works, we should support it. If it doesn't, we shouldn't." So we are in the church of what works today, and the president, I guess, would be the bishop, and we're excited to have this conversation. What does that make me? I don't know. I feel like I'm getting into an area where our lawyers wouldn't be happy.
We'll advise you later.
Thank you. So let's go ahead and kick off this conversation, starting with Mike, who's going to tell us a little bit about the implications of the research, the ongoing and future evaluation of the model, and what is needed. So, Mike, you want to kick us off?
Sure. Thank you. So I could probably talk for a long time, and I'm just going to pick a couple key things we wrote up. If you get the report, we talked a lot about implications from what we learned in the evaluation. But I want to touch on a couple things. And the first thing I do want to do is kind of jump on the bandwagon and commend LAYC for doing this evaluation, and particularly for using a randomized controlled trial. That's just, and I know they were interested in doing it even before they got the SIF grant, so it wasn't that someone was making them do it. And it's just really hard to convince organizations that that's the right way to do things, that it really is the best way. If you can do it, there are times when you can't, but if you can, it's the best way to really show whether something works or not. And usually you get a lot of arguments against doing it. Usually organizations, what happens is they serve whoever comes to the door, and when their slots are filled up, they just stop serving. And so in an RCT, they say, well, look, we're having to tell all these people you can't have our service. And you have to say to them, you're already doing that, you just don't know who those people are, and now you do. But really, this is then a fair way of allocating who gets this program. And that way, it's not just about doing evaluation and establishing the base. That's a benefit of, in a sort of an odd kind of benefit when you think about it, of the fact that you can't serve everybody. So let's figure out who does it work, who does it work for. And so the fact that they were willing to undergo this is really commendable. And I think things like SIF and the other innovation grants that require high levels of evidence are just really important to follow through on. And so I think Brett, I only got to hear the beginning of his comments when he presented, but I know he pointed out that in terms of understanding what works for vulnerable youth populations and attaining a successful transition to adulthood, the evidence base is really, really small. In the youth employment field, we've been doing research on programs for at least 50 years, and literally 50 years, and we barely have any idea what will work for helping youth gain employment. So it's really important to keep trying to come up with new innovative approaches, and this particular program therefore really makes an important contribution to that evidence base, because there were some important outcomes that were achieved. So I kind of want to talk just briefly about a key thing about the program model, and that's this use of a person who is actually a paid full-time staff member. So what's important about that is, as opposed to models that are, say, try to pair young people up with mentors, very valuable thing, but the difference is this person, their whole objective is to work with that youth to figure out what does the youth need, what does the youth want, and how are we going to get them there. A mentor is great for maybe helping occasionally and being someone you can talk to, but their objective isn't specifically get you where you need to go. And the promotor not only does that, but because they work with them for a long period, they also become a mentor. So it's kind of like two things in one. It's a real benefit. And we do see in the data that they're apparently successful. These youth, as Brett showed, really do engage. They have a lot of contact with their promotors, and they work with them over a long period of time. And that length of time is also another really critical thing. Certainly in the mentoring literature, we know that short-term mentoring has no value. It takes a while to establish the kind of trust and rapport that's needed to really make progress. But even once you do that, to kind of keep it going, because if we were comparing this to just a population that wasn't involved with the Latin American Youth Center, what we know is that even disconnected or opportunity youth are resourceful. They'll find ways to get by. It's not being successful, but they will get by. So they will manage, and I know I study a lot of youth aging out of foster care, and what we see is they leave care, and for a year, somehow they manage. They're not homeless, they're probably couch surfing, but they're getting by, not always in good ways, but a year or so goes by, and then life just falls apart because there just was never a support there, and their ways of managing just no longer can sustain them. So being able to work over a long enough period of time, as I said, develop that trust and rapport is really another critical element to the program. Now, one of the risks then that I think has to be thought about, and haven't seen this elsewhere, is this idea that it is a job, and that means people quit their jobs and they go for other jobs. And how does that affect this youth if you've spent a couple years building that trust and rapport and suddenly you leave to go somewhere else? And I think that's an important thing for the organization to think about, but the field as a whole needs to think about that, because one interesting thing is that about the results of this program is it's starting to fit into a pattern. I just was at a conference on youth aging out of foster care, and in the foster care area, first, there have been very few randomized controlled trials. As I said, it's hard to get people to do them. And of the ones that have been done, most have found no impacts. And that's really, I'm going to digress for a moment and just point out that that's really important about why you do RCTs. Every one of these programs thinks we're helping kids, and most of them are, I'm sure, in some way. But they'll say, oh, it's unethical for me then not to give this program to some youth who could use it. And I say, it's unethical to give them a program that doesn't work. And we've got plenty of them, unfortunately. So proving that it works is really important. And what we've found now of the RCTs in the foster care area, the ones that have made a difference, all have this intensive case management as one of their central cores. Just to give you an example, because it was a very recent evaluation of a program it's now called YV LifeSet. It used to be called Youth Villages. They did an evaluation in Tennessee, and they found quite a number of positive impacts. And the key component of that program is an intensive case specialist, they call them, who works with the youth in the same, it's not quite the same program as the Promotor Pathway, but same principle. And there are a couple others that have shown success in this area. So we're really building a knowledge and evidence base that says having someone who really develops this kind of relationship with youth is really looking like the way to go for success. So the only other thing I'm going to talk about then, somewhat more evaluation related, because I'm one of the evaluators here. Brett mentioned about what a service-rich organization LAYC is. And so, as he pointed out, the comparison in the evaluation was, he called it top-up. I would call it treatment plus. That is, LAYC already is a treatment. It is a program. It's got lots of great services, and it would be nice to know how that compares to youth who don't get access to those kinds of services. In this case, what we're comparing is those who do versus those who get all those services plus the Promotor, and yet we see this increment that the Promotor provides. And rather than think about it from that point of view, though, I want to think about, if we're going to replicate it, which I think we're going to hear about, how does that affect whether this program works? If we put this program, if we try to replicate it, do we need to put it in a place that has all the services or a rich body of services like LAYC, or could it survive on its own where all the referrals just go out to community resources? I don't know the answer to that, and I think that's something we really want to think about. My guess is that having them all in one place, obviously they don't have everything, there are still referrals out, but having a lot of these services in one place probably does make a difference. But I think that's really important. And I will then stress the value of replication, and I think we've got a program that looks like it works. There are lots of other evaluations, unfortunately, that have shown programs work in one place, and when they get replicated, they fail to replicate. And there are a lot of reasons for that, and frequently it's because there wasn't fidelity to the original model that was being put forward. But whatever reason, the term evidence-based is being thrown around a lot these days. But to really be evidence-based, you really have to show that not only can you do it once, you can do it twice, you can do it here, you can do it somewhere else. That's the only way we know this program is really an effective program, as opposed to just did well with these people in this particular situation. So I really think replication will be really valuable. But as I said, I think in the process, thinking about what does the population of youth being served look like in another location, and what does the other body of services look like at that location? And I'll stop there.
Thank you, sir. And we'll come back with some follow-up questions, and certainly write down your questions if you have some questions for Mike. We didn't practice this backstage, but since we're running a little delayed on time, when I sit to the top of the chair and I start leaning in and peering at you,
I got it.
That means wrap it up. Sorry you had to be there. Melissa, let's go to you. Melissa,
So subtle.
I try. Melissa, we were talking about everything else backstage except for that. Melissa is going to talk a little bit about the purpose of the SIF because I've forgotten in my 2 years at and I'm kidding. But she's going to talk a little bit about SIF, how it impacts community-based organizations like LAYC, and the development of a business plan for scaling and replication around this work. Melissa?
So I'll make it quick. This is where coming from New York City helps, and now being in the South. So first, I just want to say, I've been here a long time. I want to just acknowledge Lori. I think there's probably not a single person in this town who does not know who she is, and they probably never met her, but they heard she wants something. But I want to acknowledge the fact that Lori was a great partner to me when I first started my not-for-profit, and one of our programs was at LAYC. And what I realized there is that, to me, the Promotor program is indeed an expansion of what Lori was about. You could not talk to a single student there that came to our program as part of LAYC that did not talk about Lori and the staff. And I think that we often use phrases that have no context, but this truly is about a village. And it's a village that Lori created, and now it's great to see expand. Are there promotories in the room? Raise your hand, please, and give them a round of applause.
Hear, hear.
So, as Michael mentioned, I had the privilege to serve in SIF for a period of time and got to know LAYC and certainly knew of VPP before then. But I think there's three key things that I think are significant on why this village is an important concept. This concept that Obama put out there around shared risk and promoting what works is really around how do you get the public, private, and social sector to actually be held accountable. And I think in addition to all the financial things, as somebody who has 6 kids and grew up with lots of programs, this is also about how do we actualize the moral obligation that particularly youth providers have to young people. This is not just about service provision, but it's actually about making a moral commitment to improve someone's lives. And we oftentimes throw that in a mission statement, but we don't hold people accountable. So I will say I have my pros and cons with RCTs, but I do think this issue of holding people accountable is extremely important, and that's what SIF was about. To the extent that the government held itself accountable. So the fact that there was VPP as an intermediary, we knew what we knew and we knew what we didn't know. And we don't know what works on the ground. So this use of intermediaries is very important. And I do want to acknowledge Carol and Michelle and all of VPP for stepping up to be a partner in that. The other thing was around evidence, which I think we have really spoken about. But this other piece was around scale, right? That it's wonderful it works in one place, but recognizing that particularly for the demographic that LAYC serves, they are dramatically growing all over the country, even in some places you would never think. This is not the demographic that is the urban group. They are in the suburbs. They are in the country. And so this real push for scale is really important and significant. And so those three elements have, I think, really positioned SIF to be a catalyst for not just what works, but holding up the moral commitment that we've made, and also having mutual accountability and helping improve communities cost effectively, but also ethically. And so I'm proud to have been part of that. I also want to say that this issue of it takes a village, when I finished at the administration, I had the privilege, thanks to Marta, to work with LAYC, to have some of my students, undergrad and graduate students at Georgetown, to spend a good portion of last summer with Susanna and Lori and the promotories and the students, to really bridge this gap of, here's what the RCT says, now what do we do with it? And as someone who spent a lot of time for a profession doing business plans, I would say that the presence of evaluation was critical, because it actually allowed us to build a successful business model around what works and not what we were guessing at. And so it really laid the foundation for how do you make these scaling decisions of what do you replicate, what do you modify, where is cut and paste appropriate, where is the need for local cultural competency and relative adjustments necessary. And so we looked at the results and had several students spend a lot of time and were able to determine what were the key factors that were required for replication, like the presence of a clinical supervisor, like the presence of a paid promotories. And what were other areas where there was some flexibility? Because I think what the results showed is that this is good for a high population of generally more at-risk students than most. But there was some value to subsectors, looking about teenage parents, thinking about folks who had been in touch with the criminal justice system. And so thinking about replication, not just going from one comprehensive youth program to another, but were there possibilities to work with OJJDP? Were there opportunities to work with teen parenting programs so that you take advantage of where there are rich services but have a very specific focus? To your point, I just want to add that the students had a chance to talk to promotories. And I do think that in the typical world, people always worry about the retention of talent management. We didn't hear from any single promotory that they were worried about leaving. Because for many of them, they were already getting paid to do this work. Their challenge was it wasn't working. And to now have the luxury to work with people that they actually have a strong commitment to, have been doing for life, and to actually see the positive results. So that was one of our concerns, but they said, this is not one of those where I'm looking for something better. This is where I've actually finally found what I'm supposed to be doing as a psychologist, as someone who's referring, and as true trust builder with these young people. The biggest thing also was that this research allowed us to actually calculate a social return on investment for LAYC. And thanks to some great graduate students, we calculated that with every dollar invested in LAYC, there is a $3.97 return in social value. And that's pretty significant. And in this time and day and age where there are not a lot of VPPs all across the country who understand the role of restricted funding, but more importantly, R&D funding and discretionary funding, that's extremely significant to be able to talk about the moral commitment, the evidence and results, but also about the financial capacity that's required and that the results you're actually going to get, and that really is an ROI. And so, I just really I'm honored to be here. I kept saying, why do you want me here? Because I think that as somebody who's been in this city for a long time, we know intuitively that LAYC works. And so for me, as someone who's been a resident in DC, who has 6 kids, who's been intimate to the program, it is an actual privilege and very humbling experience to now be able to tell the world that LAYC works. To tell them what we already knew, which is always the case, right? We already know. But I also think to be able to now put it in a sense where it's not just limited to one geographic area, it's not just limited to one type of student, and it's not just limited to one type of program. So with that, I would say recognizing from an administration perspective that when we think about what the demographic changes are, LAYC, unlike other programs, truly took on the most hardest risk, youth. And that's going to be important because they typically are those that are not only just out of foster care, but out of services. And so figuring out how do you recapture that group that I think many institutions are willing to lose is significant. As a taxpayer, this is probably the best program that I want to invest in as we continue to think about the fiscal challenges that we have at a city level, state level, and regional level, to know that our money is actually working. And I would say just as a parent, to know that there are indeed caring adults who I can honestly would do this whether they were paid or not, but to know that that is indeed the difference that is made when you enter someone's life. I thank Lori and Susanna, VPP, and SIF for proving what many of us already know and actually allowing this opportunity to go to other communities. And thank you for having me.
Thanks, Melissa. Jen, let's go to you. Tell us a little bit about choosing to become a replication partner with LAYC and the benefits for the community that you serve in Southern California.
Absolutely. So I had the distinct privilege to meet Lori at the Clinton Global Initiative in Denver last year. And I had read a bit about LAYC and the Promotor Pathway program. And Project Hope Alliance is hyper-focused on ending the cycle of homelessness. We say one child at a time. And so in that, we come from a place, as you said, that says out loud, we have a moral obligation to make sure that the programming, the interventions, the people that we're putting into the lives of these children are not only based in fact and efficacy from the evidence standpoint. So, the data should always drive programming. Data should not drive fundraising. That is a fundamental value of Project Hope Alliance. And we believe, and having been one of those kids that grew up in motels during my childhood, and kind of knowing what I saw that helped, didn't help, what was available and what wasn't available, we were looking for true partners. And the second that I met Lori, I knew that she was someone that was not only a person of character, but that she was always looking out for the kid first. And that matters. It matters significantly. And so as someone who is choosing a partner to engage with, I believe that one of the most critical components is making sure that the values of the organization that you're partnering with organically match the values of your organization. And also what I knew the moment I met Lori was that she was someone who was in it to make sure that the lives of every person, every youth, every child that LAYC touched was better because LAYC had entered it. And that is something that requires a tremendous commitment to accountability, a tremendous commitment to thinking outside of the box, and a tremendous commitment to being willing to say, you know what, this doesn't work, so we're going to stop funding that, and then we're going to take all of our resources and our talent, and we're going to find out what does work, and we're going to be brave and daring enough to try it because our kids deserve it. And so when we learned about the Promotor Pathway program, similar to Lori giving Susanna the credit, without a doubt, I have to give Nicole Delaney, our Director of Programs, the credit, because I too come back with a lot of these ideas. Oh my gosh, we have to do this. So it's, people get nervous, right? Like I come back from something and everyone's like, oh no, no eye contact, at least for 24 hours. Maybe she'll like forget about whatever this idea is. And so I came back and I met with Nicole and I said, I think this is brilliant. And you know, we're a small organization, right? So when I started on the board, our total operating budget was like $186,000. We're now at $2 million, which is, you know, we're very fortunate for the community's investment in our kids and families. But this was going to be a really big commitment, and it was going to be very outside of the box for what Orange County had seen. But we knew that we had a true partnership. And when you know that you have a true partnership and a true synergy in your values, then I say, let's go for it. And I also knew that there was this very intense commitment to allowing for the data to drive the programming, and that we could talk about what didn't work, and we could change what didn't work, and we'd have partners in that process. So we met with various superintendents throughout Orange County. Surprisingly, while the national statistic is that 1 in every 30 child experiences homelessness, in California that number is 1 in every 6. And in Orange County in particular, 70% of all homeless are families with children. So we knew that whatever we were doing was not working, and we wanted to find out what did. And the superintendents of schools were also wanting to make sure that they had programs that did that. So we went and met with various school districts. The superintendent that was most passionate to bring the program to its high school was actually the superintendent of Newport Mesa Unified School District. So I hate to even bring up this show because it does not represent Orange County. But if any of you have seen like the Housewives of Orange County and all the video that goes into all the nonsense of that show, you certainly would not think of homelessness, right? You wouldn't think that the Orange County Department of Ed has identified over 32,000 homeless children in Orange County. But having been a poor kid in a rich neighborhood, that economic disparity is intense. And it also means that there is a tremendous lack of resources. We had done a study 5 years ago in Orange County that indicated that the greatest dearth of resources were for youth ages 18 to 24. And we also knew that the shame that is associated with homelessness and poverty is a tremendous barrier, most particularly in highly wealthy neighborhoods, because there's such a chasm between the haves and the have-nots that kids don't want to come forward and self-identify. And so the superintendent asked if we would please place the program at Newport Harbor High School, which is in Newport Beach, California. And you know, we've got this gorgeous ocean, but we also have a tremendous amount of poverty. And so we partnered with a high school. We actually have an office on the high school campus, which is amazing. We've decided not to brand that office because we don't want to continue any of the shame associated with accessing resources. And then we partnered with a faith-based church that has a campus literally right across the street from the high school that offers a lot of different things that the youth take advantage of every day. And so by doing that, we found that we could kind of bring together all of these different things. And as you referenced, President Obama said, whoever comes up with the idea, whoever the partners are, let's get them involved and let's get it done. So we just owe a debt of gratitude to our entire community for what it is that Lori and her team has come up with.
Thanks, Jen. Lindsay, why don't you bring us home? Talk a little bit about the importance of funding evaluation work and building this community of practice.
Thanks. Yeah, I think I'd put into 3 categories the reason why we are so excited to get in this work. First, it was this particular intervention focusing on this underserved population with enormous potential. And I mean, the bank's mission is to end poverty and boost shared prosperity, and that just fit right into with what we're about. The second thing was this organization. And organizations matter a lot to funders in terms of who we invest in. And it's funny that Melissa mentioned this in her comments. So Lori's created a culture at LAYC of real generous leadership, that we're going to help not just what we do, but we're going to help other nonprofits. And I love the fact that Melissa mentioned it, because that was one of the things I'd always seen. And and this area of evaluation, there's lots of other nonprofits need help in this space. And we saw it immediately. Brett and I work on a project called Measure for Change, helping build nonprofit capacity about performance measurement. And the people first jumping in to help their peers were people like Tony and his predecessor, Isaac, who do evaluation work at LAYC. And being able to work with those types of, invest in those types of organizations is important to us. And then finally, actually the opportunity to invest in the evaluation work. To help LAYC understand its work better and spread its benefits was really kind of opportunity we've been looking for. And, we know that there's not enough funding out there for evaluation. And I know Brett presented a great study, and Mike, I hope you'll let me know whether this rises to the rigor. I did a survey where I talked to a lot of people. And all those people happen to be nonprofit leaders. And 100% of them said there's not enough money for evaluation to correspond with the demand that funders are making for nonprofits to show impact, right?
Did you have a control group?
Yeah. So we know this, it's a truism. We know it's there. And so we're excited about kind of jumping into that space and meeting that need that we know exists, because it makes such a big difference once that investment's made and nonprofits can get a better handle on what they're doing and understand what impact they're having. To me, the biggest, and again, Melissa put a number on it, it makes our dollars smarter, right? Dollars are worth more now that are invested in LAYC because of this study, because of this data. It makes these dollars more efficient, and that it's not only going to be happening here, but that it's going to be happening elsewhere. It's exciting to see, because then we're talking about something that funders always talk about, and that is not wanting to put in money in some kind of endless hole, but the idea that we're going to be investing in a group like LAYC where there's going to be a return on these funds, that it's going to be it's creating the social benefit at a much greater number that's going in, and that it's not just going to be here, but that it's going to be spreading to other places. I mean, those are the type of opportunities that private funders are looking for.
Thanks, Lindsay. Just doing a quick time check. What time are we going to wrap the panel? Are we still wrapping at 11? Is that the goal? 11:05? Okay, great. So just a couple quick follow-up questions, then we'll come to your questions and the live stream audience as well. Okay, great. So get your questions ready. So Mike, just a quick follow-up question for you. What do you think is the biggest nugget for the field coming out of this study? What should people really be looking to as a gem, if you're someone that's working on the ground doing this kind of work? What is it that should be the headline for you?
Well, I think I'm going to just basically repeat what I said, which is it's this intensive case management. It's having someone who works with the youth intensively, regularly, consistently, and over a long period of time. And that's just consistent with other things we're finding that seems to be an important thing that makes a difference.
So we're doing a pretty big push right now with My Brother's Keeper and from the federal government on mentorship. I don't know if anyone saw this great ad we did with Steph Curry and POTUS over the weekend. And so we're trying to call people to mentor. And it's connecting to mentorship.org, which connects with all sorts of local organizations. If you were to change how we were approaching that campaign based on what we've learned from this, instead of just calling millions more to mentor, what do you think we should be calling people to do?
Well, mentors are important. I'm not knocking mentors. And there's definitely, certainly, I'll say a widespread belief, maybe less evidence, but that a caring adult in a youth's life is really important. And so, not quite sure how to answer that, except, so I think developing mentorships is important, but then also pushing to this idea of getting the youth connected to someone who really can connect them. So a mentor is really great for someone who can be a role model, someone who can help them with some of their daily stumbling blocks, but but doesn't usually quite go to the point of saying, you need to get signed up for school, let's go get you signed up, things like that.
All right, thanks. Melissa, in the time that I was running the Social Innovation Fund, what I really encountered by lots of folks that were running nonprofits all across the country was a fear around this new conversation around evidence. And I remember I did a workshop at the Points of Light conference, and we got a small room because I figured, you know, there are not going to be that many people that are running volunteer centers across the nation that want to come to this session. We had standing room only. People were overflowing in the doors. And what I remember from that is people said, our funder said this is coming. We're going to have to really have evidence. I don't know how to do it. I can't afford it. I don't have another staff person. Oh my God, what am I going to do? We're going to go under. So what do you tell folks when you're dealing with regular nonprofit organizations who don't have the World Bank in their corner, who maybe don't have an evaluation person on staff? How do you tell nonprofits where to start in this space?
Pray. I mean, I think that's a challenge, right? I mean, to your point, right? I think that we know most budgets are less than 15% for M&E, and the cost of an RCT wipes that out. So I think there's a couple of things to tease that out. One is that I think we as funders, in whatever role you sit, have to make sure that we are creating a pathway that people desire to engage in this activity. Evidence cannot be punitive. And I think a lot of that fear is, if it's not working, are you going to shut me down because I'm already beating the next person next door to me to get that funding? So I do think we need to create a culture that says we actually want you to do this, because I do think there are enough programs where if they are able to clearly articulate the value to them, but right now I'm not sure we can even articulate that value other than, I hate to say it, it's required. I think because so far the bar has been relatively low of, does it work? Ours is, what are your outputs, not your outcomes. So I do think there's just a general culture shift from philanthropy, from government, that says this is important because. I think then you will then have leaders like Jen, like Lori, like others, who then can convince funders that this is okay and that this is actually going to be helpful. But I do think that there are not enough significant third-party evaluations that are yielding relevant results because people are not opening the doors to honest review, and people are afraid. So I think what I would say to nonprofits is, think about it, but don't think about it as I have to do it right now, but really create that path. One, because you want to make sure it's the right study. You want to make sure that you're getting the right groups, you're asking the right questions. If it's LAYC versus LAYC Promotor, if it's LAYC versus non-LAYC, those are the little things that make a difference, and then also allow for replication. So I would say planning is important. To the extent that people like Lindsay and others want to fund, I would say pre-evaluation partnerships, so that there's a culture of acceptance in partnerships. You know, at the end of the day, this is outsiders coming and evaluating your program. We all have a fear of bias because it does exist. And so I think once we can eliminate some of those things, I do believe funders will feel comfortable recognizing they may not get the perfect score. Groups will feel comfortable in allocating not just financial resources, but the human resource. I think there's also an underestimation. I know how much time Susanna and Tony spent with us in doing the business plan. I can only imagine. And so I think we also have to be honest about the opportunity cost and make sure that that is validated, but also valued on behalf of the organization. So I would say to funders, shift the culture. To not-for-profits, plan. The same way you plan to roll out a program, plan to roll out evaluation, because I think LAYC and many others that you all have done as well as others proves that it actually can yield successful results. But I do think we have to put the responsibility on the funders, and I think that's where SIF was great, right? Because we would have conversations around, well, what if this is not good news? And that's okay. We were willing to take that risk. So going back to that model of shared risk, that's where, you know, I would say after 2016, my hope is that these key tenets, less about you have to get an RCT, but shared risk, support, learning exchange, evidence exchange, that's what philanthropy picks up. I think that's what's allowed SIF to actually get these results and actually have positive results because people are not afraid to share.
That's helpful, Melissa. Lindsay, a similar question for you. You know, in the private sector, there are these market forces that stop us from investing in things that nobody wants. Right. So Clear Pepsi went away after nobody didn't want that anymore. In our field, you got a good funder who likes you, that has a purse string. We keep investing in these stories. We have these beautiful galas where we go and we pat ourselves on the back, and that organization is really just serving people and not having any real impact in the community. Are you seeing a shift? You know, the president says if it doesn't work, we shouldn't fund it. Are you seeing a shift in funding spaces where we're having the courage to stop funding things that don't work? Because ultimately, that has to be a part of the value proposition, that we free up some money from the folks that aren't doing it well. After they've done their course corrections and tried things again, we've got to stop funding things that don't work. Are you seeing a shift there?
Not yet. And the reason why is that the organizations that are willing to jump in with both feet in measurement and evaluation aren't doing it yet. You have to provide the contrast. People are not going to walk away from the anecdote without the contrast that they can invest in. And there aren't enough groups, but some of this you kind of turn back to the funders. There aren't enough funders responding to these calls from groups that do want to invest in measurement and evaluation. And one of the things that's really important that we've seen just in the last 3.5 years really investing heavily in this space is it's not a switch you can flip. Measurement is deeply personal to the culture of an organization. And it takes time to get that ingrained in the thinking of how they're going to function, how they're going to make decisions. And it's not something we can do overnight. And so that's why the investment piece is big. But I don't think people are going to walk away from the anecdotes until there's an option, right? It's because you could go back to your regular Diet Coke. You didn't need to drink Clear Pepsi. If there's only Clear Pepsi, you might have stuck with it.
That was deep. Thanks, Lindsay. And Jen, a final. I'm gonna examine that one. Jen, a final question for you. You know, when I think about replication, I oftentimes think of like a McDonald's franchise model, right? And how you keep a local feel, a local passion. So in Maine, in the summer, if you go to McDonald's in Maine, you could get a McLobster roll. Or if you go to a McDonald's in North Carolina, you might be able to get some chicken gizzards. And so I wonder, when you think about replicating an evidence-based program, how do you keep the tenets that work, that are a part of what makes it work, that's going to lead to transformation, but also making sure you're taking into account what your community's unique features and needs are?
Well, and that's very important, because you were speaking about local culture and how that bears relevance on how you would actually implement a program. So I think that the thing that's most paramount in that scenario is having a true partner. So this isn't something where you open it up and you have a Subway sandwich, and a Subway sandwich has lettuce, tomato, a certain amount of meat and a bun, and then anyone can make that sandwich. And the sandwich is going to taste the same anywhere you get it because you have the same, produce supplier or something like that. You have very unique socioeconomic, cultural, ethnic, all different types of variables. And so that's why if you are very selective in the partner that you pick, and there is a true transparency and trust, and neither partner is operating from a place of fear, which I appreciate that funders are definitely a critical part of this conversation to get us out of this fear reactivity spot. But as a social impact leader, I personally take responsibility. I personally believe that it is our responsibility to say, I will select partners that are operating from the same culture, value-based position as I am, so that we can tweak the things. We can have constant dialogue, and when we find things that don't work in our area that maybe are a little bit different, maybe it's related to transportation, maybe it's related to utilizing rapid rehousing, whatever it is. Languages, maybe you need to have different languages. For example, when hopefully we're able to move into Garden Grove, one thing that we would be looking to do is to have a promotor who is bilingual in Vietnamese and English, as opposed to right now we have both of our promotors are bilingual in English and Spanish. And so those are things you have to factor into it. But if you have a true partnership, you can tweak those pieces as long as the foundational tenets of the program are such that they can be replicated. And you don't deviate from the model. When they give us this very well thought out, shown to be effective screening tool, if we go and we say, forget that screening tool, we're not really going to follow that. We're just going to pick kids that we think should be engaged in this process. We completely eradicate the evidence-based effectiveness of this program. So there has to be that partnership both ways.
That's really helpful. Thanks. If you have questions in the audience, just stand up, and I think someone's going to come to you with a microphone. And just tell us your name and organization, if you don't mind.
Sure. I'm B.A. Cockburn from Lutheran Social Services of the National Capital Area. This seems like a wonderful model, and I commend LAYC for the model. My question is, in the results, most of the subgroups were male, where you had the big difference between the control and the treatment. So I'm wondering how you're going to tweak for women and girls in the program, or if there's going to be a tweak in the processes and services for women and girls.
Who can
I might be able to address that. So that is something that we are conducting sort of further, I would say, performance management work. And that's one of the other great assets to having this type of evaluation, is that it allows us to look at what worked well, what maybe didn't work so well, and what can we adjust. So right now we are looking at the outcome areas that did seem stronger for our females, the ones that didn't. We really do try and make best use of analysis and assessment of what services we were connecting our youth to as well. So there's going to be sort of a multi-stage approach to see how we can improve some of those outcomes. We're committed to constantly learning and seeing more. And we've never necessarily partnered specifically, for example, with programs that are directed, just for females. Maybe different rites of passage programs or things like that. And maybe that's something that we could explore as a resource. So all of that will be part of the performance management that also comes from the evaluation.
Thanks, Susanna. Is there another? Oh, please, Mike, go ahead.
I wanted to add to that. One thing, I know Brett said that there wasn't much that predicted engagement, but actually one of the things that did predict was caring for a child, that the women who cared for a child were more likely to engage with their promotor, and you saw the high percentage of young women who already had children. And so it could be that what was worked on with that youth over this time really didn't show up in the kinds of outcomes we were looking at, but better parenting, better taking care of their child may have occurred because of work with Promotor. I can't say, but in that sense, the Promotor is providing sort of benefits to two different generations.
Thanks, Mike. One more question in the audience? Any from the live stream audience? I don't know who's watching that. All right, hearing none, thank you, panelists, and thank you again, LAYC and VPP.
Thank you so much. This was an incredible conversation. Thank you again to our panelists. And we really do hope that this continues, that this conversation really continues to happen. We see that it's something that really should be occurring both in the field, in the foundation world, and in the research realms as well. So making sure that we keep this conversation about what works and how we can invest in that and how we can improve and expand on what's needed for our communities is really important. The truly most important reason we are here today is the young people. Their potential for greatness is boundless, and I'm really honored to invite two of our young people that have decided to come today and share a little bit about their story and their experience with the Promotor Pathway. So first, I would like to invite Daniel, who will come up and share his experience. Come on up, Daniel.
Good morning. I heard about the Promotor Pathway program when one of my friends joined. He told me that it was a lot of help to have someone talk to him about the struggles he faced, like obtaining a job, struggles he faced at home, or just having someone to vent to when he needed some motivation to push forward with his goals. So I tried applying, and because of the evaluation, I was told it was a lottery. So I knew it was a 50% chance I would get a promotor right away. I ended up being part of the control group. They waited those 18 months to get started officially working with my promotor, Jorge. I was excited about becoming a client. Even if I had to wait those 18 months, I would. At this time, I was working to obtain my GED at the Latin American Youth Center. And the promotor office was right next door with a couch. So I was always spending time in there talking to talking to the promotors. We always had conversations about school, work, sports, and I was able to just relax and joke around with them. Even though I was not officially a promotor youth, they always welcomed me into the office, and that's where my bond with Jorge began. Then finally, after those 18 months, I became a client. Once I became a client, things started to get done. What my friend had told me about the Promotor Pathway was right. I remember my promotor, Jorge, asking me what was one thing that could make my life better right now. And I didn't have to think about it. I said it would be nice to sleep on a bed. I had been sleeping on the floor for almost 5 years. Jorge helped me. Jorge jumped right into, he jumped right in and started making referrals, and I immediately felt like he was on my side and willing to help me in every way he could. He told me I should have a bed to sleep on and help me get one. We made referrals to a community organization that helped with furniture. The Promotor Pathway got a U-Haul. Jorge and I packed my furniture and delivered it to my house. Having furniture, a table, a couch, a bed to sleep on, it felt like a miracle. As a mentor, Jorge helped me to learn how to be professional at work and then how to handle things in my personal life, and with that same professionalism. When I was in the conservation corps, LAYC's out-of-school youth program, I was working on my GED and completing projects in the field designed around the conservation principles. Jorge held me accountable for my actions as a student and a leader of this group. As a teen, I made impulsive decisions, and Jorge helped with the conservation corps staff to help me develop into a professional adult. Since then, I've attained my GED, completed the conservation corps as a group leader, completed 1 year in AmeriCorps in DC, completed 6-year credits in Bard College Clemente course, and I'm now employed with public allies in the community with youth, much like who I was. My promotor, thank you. My promotor didn't just help me with my professional accomplishments, but with my personal growth. I was 16 years old when my son Xavier was born. I was not ready to be a parent. Jorge was there to help me learn the ropes and give me advice on everything from diapers to managing my money towards a better future for myself and my son. After all, I was only 16 and immature. Jorge helped me learn to communicate in my personal life using some of those same professional skills I had been developing. When I became frustrated, I would go to Jorge first. He will help me calm down and respond in the best interest of my son. Now I'm able to communicate in a more civilized way and make sure my son has everything he needs and that I could be here for him. During all this time, I was able to express my feelings, emotional thoughts, and struggles I faced at home and much more. For example, Jorge was there when I was upset, no matter what time of day it was. He was there after hours and even made time for me in the weekends. To this day, Jorge is like a big brother to me, and he has followed me through and been there with every struggle and achievement. Without Jorge being there consistently and connecting me to new opportunities, I would not be where I am today. My name is Daniel Salgado. I'm 21. I'm a positive youth developer. I'm a young father with 4-year-old strong soldier that I slay dragons for. I slay negativity and make positive choices in life. Thank you.
And as a point of reference, his promotor, Jorge, is here with him today as well, supporting him as always. So thank you very much, Daniel. And last, we have another one of our young people, Miss Joni, who is also going to share a little bit about her story working with the promotor. So come on up, Joni.
Good morning. My name is Johnny Allen. 7 years ago, I was 16 years old and lost. I was going through a lot of things and having some life challenges. Some of those were being homeless due to family not accepting my sexual identity, finishing my GED, and dealing with my anger and loved ones. lost loved ones. I didn't really have support or family. Then I was introduced to the Latin American Youth Center through Child Protective Services. I worked with them, received a promotor, which at the time his name was Jeffrey. Jeffrey was transitioning out of LAYC to move to California, so I was soon introduced to my new promotor, Elmer Diaz. I worked with Elmer for 7 years, and he helped me get where I am today. He was and still is very supportive. The Promotor Pathway has played a huge role in the person I am today. I received housing services through my promotor when I was a homeless youth. Elmer helped me get into the Latin American Youth Center Transitional Living Program. This was an 18-month LGBTQ housing program located down the street from the main LAYC site. It helped me out so much, I finally had a place to call my own. That took a big weight off my shoulders and made me more grateful and more motivated. Throughout the 18 months I was there, my promoter made sure I had things I needed. He checked up on me, took me to my appointments. He helped with transportation, and I could also talk to him about things that was going on in my life, get advice, and just have an ear to listen. Elmer used strategies to help me be calm in times when I was upset. He will remind me that I have important things I want to do in my life and why it would not be a good idea to completely lose it or give up. Having a promotor in these times saved me from acting out of anger and helped me to think my actions through. Having a promotor to check in, talk with, and hold me accountable for what was was a huge reason why I am in school today. A big part of my struggle with school was motivation to keep me going. School has always been hard for me, and when I was expelled from high school in 9th grade, it seemed everyone gave up on me. Having constant support and encouragement my promotor gave is what I needed to be successful in school. I set academic goals with Elmer, and he told me I could achieve them. However, that is not just with Elmer. I can always go to anyone in the promoter office for help. Recently, I lost someone very close to me. I didn't have a way to get to the funeral in Baltimore. The promoters came together with a plan and how I was going to get to Baltimore to that funeral. That meant so much to me. Promoters take time, sit down and work with you on your goals. They help you set steps on how you're going to accomplish those goals, and then they're there every step, anytime I need it. They have gone above and beyond to help me. The thing I love the most about Promotor Pathway is they are very supportive. They have always been there. They are my family. I just want to thank the Promotor Pathway because without them, I honestly do not know where I would be right now.
Thank you so much, Joni. Daniel and Joni have been some of our youth that we've been able to work with for several years, and so seeing their growth, seeing the adults that they have become has been such an honor for us, to be able to be a part of that journey with you, and we're just so proud of everything that you will accomplish. This has been a really important, I think, conversation on so many different levels, and we do want to really sort of look forward with this information. LAYC is committed to further evaluation, and as Brett sort of alluded to earlier, we are set to engage in phase 2 of this external evaluation. We are planning to survey the cohort of treatment and control group that participated in this evaluation to see if these impacts have actually held years into the future. So we're really excited to see the long-term impacts. Really, our intention is to see some of these successes extend into adulthood, and now we'll have the opportunity to see that. So that commitment to evaluation is really a part of our work. I do also think that it's important for us to speak to or try and make efforts to what the panelists discussed, which is we do need to explore replication. We do need to see how this model will work in different areas with different populations and learn from that and really continue that effort to find what works and make it work for our young people. They deserve it. They need it. We have over 5 million disconnected or opportunity youth in the United States that are not in school and not working, and we owe it to them and to our future to really make an effort to intervene and provide them with what's needed in their lives. So with that, we are very excited to discuss and share with you all our national network. We are looking to expand the pathway, to begin testing and growing this in different communities. And we are so fortunate that Project Hope Alliance has been a part of the start of that journey so that we can begin to learn and see how this can carry over into different areas. So we have really taken some thought, and obviously with support from Melissa, Melissa Bradley and her team from Georgetown University, who helped us really plan for this, that we could take advantage of the evidence of success that we have gathered so far, and the strong theory of change that we really believe is at the core of this model and its intervention, which is that caring long-term relationship with a very highly experienced intensive case manager. So as we move forward, what we're really looking for as part of our growth strategy is to seek communities with high populations of disconnected and disengaged youth. We already know there has been a lot of research. There was a report that came out recently from Measure for America about certain metropolitan areas that have very high numbers of opportunity and disconnected youth. So we would really like to look to target some of those areas. And it's not just large cities. Keep in mind, I think one of the largest cities that had a predominantly Latino population of opportunity youth was Bakersfield, California. You know, we really do need to look to some of these different size cities, different areas, and see if it's possible to bring this intervention to them and create an impact in their community. As Jennifer mentioned, I think very eloquently, we are seeking partnerships, true partnerships. So trying to find community-based organizations that share our values, that share our mission of positive youth development, and really creating an impact through a positive relationship with a caring adult is who we are seeking out to conduct some of these replications. There are a lot of amazing organizations out across the country, and so we really hope to identify some of them to create more of these partnerships. Can you imagine if we brought together all of these amazing organizations that are doing great work across all 50 states? I mean, it's unbelievable. We need to embrace some of that communication and see what can be accomplished. And then, of course, with that, exploring joint funding opportunities, really sort of taking the time to see if there are partners that are willing to invest in different areas, that are willing to see what works and how that can be expanded. So partnering with those community-based organizations to really make this a joint effort. Along with that, we did take some thought into what the national design would be. So the idea is that LAYC would provide that core set of training and services and everything that would be provided to the organization. We would allow and really obviously have the community-based organization implementing the model on the ground, incorporating their knowledge of their community, their knowledge of the resources, their connections to the young people, and really sort of melding that in with the truly foundational points of the model, which would be all elements of the training and how we choose our promotors and how they work and how it's measured, and truly, again, embracing that partnership. But allowing the community-based organization to lead that effort. This is not about LAYC going and telling, Orange County or Salem, Oregon, how to serve their youth. They know how to serve their youth. Maybe we can just help them do it a little bit better, and that's what we really want to try and do. The role of national obviously would be to provide that service, and we are looking to provide a menu of trainings, everything from full replication of the model, if an organization is committed to actually hiring and having promotors that would be on the ground and offering these services. But we realize that some organizations maybe are not able or willing to make that full commitment, but they still want to learn from us, and we are happy to be a part of that. So whether it's providing best practices training on case management, on tracking data outcomes, whatever services, whatever we can lend in terms of what LAYC has been able to learn through this experience, we want to share with others. So that would also be a function of the national office. Of course, we will want to be constantly gathering more data, more information. So the national office would be receiving all of those outcome measures from the different partners so that we can be a part of that performance management process and see what's working, what's not working, what needs to be adjusted depending on those particular community needs, and really have that be a dialogue, a conversation that we can work on together. But at the end of the day, it would also be to ensure fidelity to the model. We really do believe in the theory of change. We've been able to see some really positive impacts, and we want to be committed to keeping that model whole. So a lot of that partnership and a lot of the role of national would be to ensure that that promotors in different areas are still holding to the key elements of the model. So all of this is really where we are looking to go next, and LAYC is incredibly excited to launch into that opportunity. We welcome anyone who has any questions, any thoughts, any suggestions about other communities, other areas that might be interested in this work, to share the research report. We did forget to mention actually that the full report is available online through Urban Institute's website, and we will also be following up with an email to all of those that were able to be here and those that are watching online to make sure that you have a link to the full study and to further information about the Promotor Pathway. But we do want to, like I said, encourage that this conversation just continue beyond today, beyond this room. But if there's any last question, oh, yes. Yes, so part of that expansion that we have been able to embark on with the pathway has been to expand in schools. So, and a lot of that was actually thanks to the Youth Connect partnership. When we originally began doing this work, we were targeting primarily youth that were out of school, that perhaps needed to be re-engaged with school, and hadn't originally thought about what this model would look like inside, sort of a place-based model inside of a high school. And thanks to the partners within Youth Connect, some of them were already working within schools. And so we were able to sort of, pick their brains and really get some ideas as to how we could bring this model into schools and perhaps try and identify and catch some of these young people before they left school. So really almost trying to turn it into a bit of a prevention model. And so we were able to take advantage of that opportunity first with our charter school, the LAYC Career Academy, and then soon after in Prince George's County, they were looking to bring in different innovative strategies to serve as part of their Transforming Neighborhoods initiative. And so we were able to expand into 3 different high schools in Prince George's County. And then as Youth Connect also continued to expand services in Prince George's County, that's what took us to Suitland most recently. So we're currently serving in 5 different schools. We then also have since expanded into DC public schools through the Community Schools Grant, and we are now at Cardozo High School in DC. So we really are starting to see and gather some data regarding the impact of promoters in schools. So being able to really measure that school engagement, that school retention, along with some of the other healthy behaviors that we think contribute to a successful transition to adulthood. So as much as we want to always maintain our commitment to disconnected and opportunity youth, seeing that this is a model that can also work within schools is incredibly promising, and we're eager to expand that as well. All right, well, if there are no other questions, I will say thank you so much for joining us today. Please take some information and we will follow up with online connections.